Our project is on freestanding emergency departments. We want to discuss convenience, affordability, and quality of care. It's me, Kristen Kirk, Mira Patel, Natalie John, and Colby Vancamp. I'm going to begin by talking about what is a freestanding emergency room. A freestanding emergency room is a facility that are geographically separate from hospital campus and provide emergency services. They were originally created to increase access to emergency services in rural and critical access areas. Um, there are two distinct types of freestanding emergency departments. There is a hospital outpatient department, and also referred to as an off-site, hospital-based, or satellite emergency department, and independent freestanding emergency centers. The differences between a freestanding emergency department and an urgent care center are when it comes to staffing, the urgent care centers will have advanced practice providers and medical assistants. The freestanding emergency rooms are going to have emergency medicine physicians, registered nurses, and radiology technicians. As far as radiography goes, when you go to an urgent center, you can get an x-ray done, but when you go to a freestanding emergency room, you can have an x-ray, a CT, and an ultrasound. Laboratory, for urgent care centers, you may be able to provide point of care testing, and then point of care testing, CBC, BMP, and cardiac enzymes when it comes to laboratories at a freestanding emergency room. Patient transfers, you can call 911 or transfer patients to the hospital at an urgent care center. And a freestanding emergency room, you can call contracted ambulance services to bring patients to designated hospitals. So sometimes they have transport services. Operating hours are anywhere between 24/7, 7 days a week in an urgent care center that are some of the times. And then some of the times, the freestanding emergency room, you can have 24/7 service. But there are some that don't. Majority of them do. Other services, you cannot provide conscious sedation when you're at an urgent care center, but at a freestanding emergency room, you would be able to have an intravenous IV and conscious sedation. We attempt to determine the role of freestanding emergency rooms in the U.S. healthcare market, elaborate on why a universal definition is essential to increase access to emergency care, provide quality care, and accountability using available data. We discovered the definition of freestanding emergency rooms varied between sources. The lack of a universal definition of freestanding emergency rooms and national regulatory requirements directly impacts accurate data and collection on reasons for patients to visits and quality care for reasons for them to visit and quality care at a freestanding emergency room. Excuse me. Explore quality of care and accountability frameworks. We are using that with available data that we have, and we will discuss how stakeholders play a role in the establishment of a universal definition and regulatory requirements on a national level. Analysis of the market. You had ability to provide top-notch emergency treatment at a greater level of customer service, according to Mortar Intelligence. Increased demand for emergency services, lack of hospital beds, ability to expand the hospital's brand and footing, capture referrals for hospital and affiliated providers, and identical reimbursement according to Ayers. However, it is difficult to find evidence to support these notions. We discovered that many freestanding emergencies do not have ambulance bays and are not open 24 hours a day, 7 days a week. Therefore, we cannot specify the exact market that freestanding emergency rooms departments represent and if they compete with urgent care centers or in hospital emergency room facilities for lower acuity patients. Given if we can infer some Given the information, we can infer some freestanding emergency rooms do not compete with in-hospital emergency rooms or high acuity patients. Freestanding emergency rooms growth is being driven in large part by hospitals and health planning expanding their footprints into growing suburban areas, according to Ayers. The increased access to emergency services could lead to overuse of resources, which would necessarily increase healthcare costs and disrupt the structure of an emergency department.
Healthcare quality is defined by the Institute of Medicine centers on 6 aims: safety, effectiveness, timeliness, patient-centeredness, equity, and efficiency. Factors we would like to measure and need to consider are patient wait time, readmission rates, resource utilization and efficiency, diagnostic accuracy, patient care satisfaction, provider availability, and treatment outcomes. However, due to lack of universal definition of FSEDs, quantitative and qualitative measures are limited to ensure quality of care is being upheld. A study in 2020 attempted to answer the questions and we had about various measures. Outcomes of the study indicated wait times were 26% shorter compared to hospital-based emergency departments. Patients were 40% less likely to leave without being seen at these facilities. In terms of resource utilization, 46% fewer EKGs, 35% fewer X-rays, and 33% fewer CTs per 100 patients were performed in FSEDs compared to hospital-based emergency departments. However, the study fails to address the differences in practice patterns and patient demographics as well as geographical locations that could lead to these outcomes, which begs the question of whether the facilities are reaching their target population and are being utilized appropriately to meet their demands. The 3 main goals of accountability in healthcare include clearly defined goals and objectives, ability to measure and monitor set goals and objectives, and protocols for actions if goals are not progressing in the desired direction within a certain time frame. Unfortunately, FSEDs are not regulated to provide standardization of care across states, leading to varying degrees of care delivery at these facilities. For example, in Texas, a state with one of the first and largest number of FSEDs, the state law mandates that all FSEDs have a lab, radiological, pharmaceutical, as well as extensive respiratory care services provided. Comparatively, in Georgia, none of the services are required for an FSED to operate. So this begs the question of how FSEDs can be held accountable to provide optimal care if degrees of care can differ so drastically from state to state. Lack of state and federal regulations on standardizing care across FSEDs can also jeopardize patient care. In a 2020 study, emergency department admission times and onboarding has been found to take an average of 24 minutes longer than from FSEDs to hospitals. This brings into question possible issues with coordination referrals from FSEDs. At this time, we will continue to see varying qualifications for provider care, protocols, quality improvement, and use of resources if lack of the universal definition of FSEDs persists.
Through the study of this course, we were able to find out that 66% of the freestanding EDs were constructed in areas that were determined to have a higher income. This was due to the fact that they were now able to charge additional facilities fees, which were able to help with the overall income of the organization. While the average patient could have been confused as to the level of treatment they were receiving, the organization most likely understood the definition of urgent care versus emergent care and the amount that could be charged for each. This in turn has encouraged the development of freestanding EDs where higher profits could potentially be made. Currently, approximately 12.4% of all emergency rooms are now freestanding EDs. While there is no clear definition as to what a freestanding ED should be or have on its premises, the federal government has recently established the No Surprise Act, which now limits the charges a medical practice can charge. Since this currently is a recent development in the grand scheme of things, the data is not available to determine the level of impact. Taking all that into consideration, freestanding EDs can still be effective in rendering the appropriate level of care at crucial times when utilized correctly.